if you're unlucky enough to actually get a shock, does that damage the heart at all?
No, so there's some very nice studies, and the way in which we measure, if you like, damage from the heart is that people measure a marker that gets released from heart muscle called troponin, and there's a number of studies out there studying exactly this, because until we test, people don't know. But there's some very nice studies showing that if you measure troponin after a shock, there is no significant elevation, and that means that we know that the troponin only comes from damaged heart muscle, and so if we can't measure it in the bloodstream out to sort of 12 hours afterwards, we know that there's been no sizable damage to the heart muscle, and of course that's what we want. The other thing you've got to remember is that the amount of joules delivered to the tissue is actually relatively low, that actually comes into contact with the heart muscle itself, and so it literally is just a bit of a restart, and there's certainly no wild damage. What can have happened is that depending on what your arrhythmia is or what the cause of your arrhythmia is, of course there can be damage to the heart muscle, but it will not be generated by the device giving you a shock. That does not cause heart damage.
Okay, thanks for that. My son has the symptoms where occasionally his heart stops for a second and then beats again. Is this ectopic beats or pacing?
If he's got a pacemaker, which by the sounds of it he does, potentially your pacing clinic would be able to help you to understand that. And so what we know when we see an ectopic, which is an extra beat from the bottom part of the heart, which we all have, it's a benign finding in everybody. We know that after an extra beat from the bottom part of the heart, there is what we call a compensatory pause, and it feels like your heart has missed a beat, even though it's actually an extra beat. And that's very common, and we see that every day in my clinic. That's what I am exposed to for patients. I think though, most people, is my experience, don't know that their heart is pacing when it is and when it isn't. They've got no idea. So I would suggest to you, from my experience, and maybe James can add what he feels, that I think that if you're feeling something, it will be an ectopic. And actually, I don't know any patients really, apart from those who've got some pacing of the diaphragm, that they don't notice the paced beat. So I would suggest you, but your pacing clinic may well be able to answer that for you by looking at, if you document very clearly it happened on this moment at 12:01, they'll be able to look at the EMG and decide what was going on at that time. So I think it's possible to know.
Yeah, I mean, most devices won't record ectopic beats, but what it can do is it can give us some interesting data. So it can tell us how much it's pacing your heart, where it's pacing your heart from. Is it pacing from the top of the heart, from the bottom of the heart, and how many ectopic beats patients get. Some of the devices even delve deeper into that statistics and can tell us that you are having most of your ectopics at night. So depending on your device, we might be able to actually get some of this information. I think, like Tom said, it's normal to get ectopics if he's not feeling them, but by the sounds of it he is. They're not worth worrying about. If he is feeling them and they're affecting him sleeping and things like that, that's probably when you need to see someone like Tom or your GP, because obviously maybe it's medication related. Maybe there's something they can tweak with the medication or something else that we can do just to maybe suppress these ectopic beats.
I think it's ectopics is most likely.
Okay. You just mentioned about these occurring at night, and this person asks a question which I've seen a few times just recently, and from time to time during the night I'm aware of very strong pulses all over my body, especially in my neck, which affects my ears and make it often impossible to sleep. I wonder if you can explain. I'll just go on. It's not exactly as I thought it was, but other people have said how they feel like they can feel their device doing something during the night. Is that likely? I mean, would you feel a download to your... No,
you won't feel a download, and the devices are low energy, so you don't feel that low energy. I think that there's several things that it could be. Now, there's a nerve that runs down the front of the chest that controls the diaphragm. Some patients at night feel a hiccup, or even during the day in certain positions will feel a hiccup sensation. I think that's different to what this person's explaining, but you can it could potentially be that. I think what it's more likely to be, in my experience, is where your heart is relaxing, it's slowing down. your head's to the pillow, for example, and you're more aware of your heart rate and your heartbeat, and any small discrepancies, one little extra ectopic beat you may feel. If you get an extra beat, you may feel it in your neck because it's pulsating and it affects the blood flow. They're all things that aren't issues. I think if you get palpitations or they continue to go on for a long period of time, that's when we need to further investigate to decide if it is anything to be concerned with. But we come across it quite often.
I agree.
I don't think the devices sometimes do some checks where they look at how much energy it's using. So some people that maybe rely upon their device to pace the heart may feel that, but the devices have a safety feature where if it's being testing your heart, it doesn't pace and capture the heart, so the heart doesn't contract. It sends a backup pulse which will contract and cause the heart to work. I think it's probably more related to just people's normal heart rates just slowing down and you being aware of it. I must be honest, I can sometimes feel my heart beating and I think, oh, it's a bit funny, and it's mainly at night when I'm laying down and just more aware in a relaxed state.
Mm-hmm. Okay. Prior to our conversation online, I was telling you about how my device beeped while I was on holiday after I'd had a bit of an episode. And this person, and I know I've seen this very often, our devices are beeping. Can you show us what it sounds like and explain why they are beeping and when? I know we possibly can't now, but is there any resource online that you can go to the manufacturers' websites?
No, really good question. It varies. There's not an international standard, to be honest. Some of them have audible alerts and some of them will have vibratory alerts and some of them don't have any at all. There's not an international standard, unfortunately. The ones that buzz, they buzz. You can feel them vibrating. It's like holding your mobile phone. The audible alerts are going to sound like an emergency siren, so you're going to get your neenor, neenor, neenor sound, and that will probably repeat every 8 hours or so. The purpose of an audible alert or a vibratory alert is to let the patient know that they need to get in touch with their clinic because the device needs to be looked at. Lots of different reasons. The main reason is that the battery's reached its point where we need to replace it. But there are other issues where maybe some of the lead measurements are a bit untoward and it wants us to have a look at that. It may be the other common one is where in your case it was trying to communicate with your home monitor, but because it hadn't been able to communicate with your home monitor for 2 weeks, it sent you an alert to say, hey, there's an issue that I want you to look at. And then you got in touch with us.
Mm-hmm.
And so it's very difficult, but just listen out for an emergency siren or a vibration. But
there's nowhere on the
not as far
on the
as
internet that we can sort of educate ourselves about them.
Ask your cardiac physiologist at your next check in the clinic if they can reproduce the sound. Some of the devices you can reproduce the sound so you know what it's like. Unfortunately, we generally deal with older patients, so they can't always hear the noises, and sometimes if it's buried beneath the muscle, you can't always hear it as well, and that goes the same for the vibratory alert as well. So it's just an added extra that the manufacturers try to use to help some people out, as many as possible, really.
Okay. I think we've got the last 2 specialist ones for yourself. My cardiologist didn't change my drugs after my last shock. He increased the pacing to 70. What is the thinking behind this?
Yeah, so I think that you have to trust in the person looking after you to understand your own clinical picture. I think that's the first thing to say. But I can imagine the reason would be that the person's feeling is that your drug therapy is good, whatever that looks like. And that sometimes changing things for the sake of changing things makes things worse. And so I think that if you haven't had many shocks over a period of time and you happen to have one, then to be fair, the device has done what it's supposed to do. The reason why he may have increased the backup pacing is very commonly if you go too slow, you can then bring about an ectopic, which brings about a train of arrhythmias, which can then set off a nasty arrhythmia from the bottom part of the heart. Whereas if you set that backup rate slightly higher, then that is less likely. and therefore the chances of you then having a nasty arrhythmia which requires a shock is lower. So I think that's a very reasonable and established thing to do
I think that's,
to prevent the device. And bear in mind your cardiologist will have sight of why the device shocked, what it looked like just before, what the device had to do to make it better. Then I think he's in an absolutely great position to then decide what the best therapy is to try and prevent that from happening again. So
yeah, no, definitely. I think I'm spot on there. So if you're getting the odd ectopic beat, we know that's benign and that's not going to cause most people a problem. If, however, you get lots of ectopic beats and they become more regular, then that sets up the likelihood of having a cardiac arrest. So if you pace the heart quicker, you sometimes have this effect where it gets rid of the ectopics and you're able to just to go a bit faster to suppress them. It seems to work really well. I'm not sure why, but it does really well. So I would imagine that's the likely cause for that one.
Okay, this is just you possibly may not know this. I work in aerospace engineering. It would be interesting to find out about how the ICD is made, materials, machining and testing and stuff. I did post a link to a video the other day which showed someone taking an ICD apart in a rather brutal way with a Dremel, but it was very interesting, and it gives he knows that obviously his YouTube site is about dismantling things, and he knows various bits, but obviously it's a very complicated piece of equipment. Is there anywhere that this person can go and look? You know,
yeah, I must be honest, not as far as I'm aware. A couple of points though, because it is really interesting, is that most people aren't aware that these are actually handmade.
Really?
Your look says it all. There's a big manufacturing plant for one of the companies in Ireland. They hand make these devices. It's like the stents. They're all handmade. These don't roll off a conveyor belt. They're handmade by skilled individuals with small hands, essentially. And that's another reason why they cost so much money. The materials they use vary. The batteries are made generally for ICDs of silver, lithium, vanadium oxide. One of the Tesla shots.
that's a great.
Yeah. And that gives the best long-term battery components. The cans are just like a titanium can. They're sealed with this header, which is, this one's going to come off because it's a demo, but it's the leads connect inside there, and the screwdrivers will screw the lead in and seal it from any substances getting in, and then all the circuitry connects to there. So they're not as machine made as probably people would imagine. There isn't anywhere that you can necessarily see. My advice, if you're more interested about devices, about arrhythmias, is to obviously be part of this group. But there's quite a few conferences that go on in the UK and in the world where they have patient days that you pay 30 quid or something like that, and you can attend. And there's talks by experts, by patients, on the different components of how they're made, what issues to expect, and common themes that occur. I know that British Heart Rhythm, which is my national society for devices and arrhythmias, have got a conference in October in Birmingham. It's worth researching that. I know there's CardioStim, which is in Vienna right now actually, and there's it was in Chicago in May for the American one, if anyone wants to go that far. But they're potentially, if you're interested in maybe the finer details, are quite good.
Companies are surprisingly helpful, is my experience. So if you are really interested and you really want to know, I've got this device, I want to know exactly, they will genuinely tell you what it's built of, but they will give you nothing about obviously the protected intellectual property components. Does that make sense? So, but they'll go a long way to tell you what it's made of, because again they have to an extent. It's a bit like stents. Stents are made of certain metals. Some people are allergic to nickel. Some people are allergic to titanium. Some people so that data is available, but you just have to search it out a bit. But they won't tell you anything that is protectable or protected.
Okay, cool. Thanks for that.